Hi class, welcome to weeks 4 and 5. This is patient chart week. We will also go over the treatment planner, so that's why we have 2 weeks for this area. It's quite a bit of information, so we're going to allow 2 weeks to complete the information. We'll go ahead and double click on the tooth icon, which is the patient chart. Say yes to allow the app to make changes. And now we have our patient's chart. So I'm going to go over this screen with you very quickly. I just want to point out we have our toolbar at the top. We have our 4 of our main modules here. The family file, ledger, appointments, and office manager icons. The 5th one is the patient chart. We don't see it because we're in the patient chart. Some other icons we'll be using are this treatment planner icon, the green chair that has the money sign. Also, you have your select patient icon, and we have some different views, charting views, as well as work chart views, and some status buttons. So we'll go over those in a little bit. This is our work chart. As you see, there are the teeth numbers across the top and across the bottom. This is our upper right, starting at tooth number 1, going over to our upper left, dropping down to the lower left at tooth number 17, and going all the way back to the lower right and ending at tooth number 32. On the right hand side next to the chart view is our procedure buttons. Procedure buttons are like quick buttons. They can help you chart things quicker. So I call them my quick buttons, but they're referred to as procedure buttons. Next to procedure buttons, we have procedure codes. So in case something is not here in a little quick button, we would choose the category. So say we have an exam here, there's a periodic exam, but say I want a periodontal exam. I have to go and look for the comprehensive perio evaluation. That would be under my diagnostic codes here. We can expand for more codes or see less codes. Each category is individualized. We have preventative, cleanings, fluoride treatments, sealants, restorative or fillings and crowns. We have endodontics, root canals. We have periodontics, thus scaling and root planing. Other type of gum treatments or procedures. Prosto removable or are dentures or partials. They are removable. You can take them in and out. Maxilloprosto, these are for oral surgeons that kind of have to deal with extensive surgery things. Also some things that deal with sleep disorders are in there. Implants, those are everybody knows what an implant is. And then prosthodontics, fixed are bridges where we have a couple of crowns together and they are fixed. You cannot remove them. It's when more than one tooth are missing. Oral surgery are for extractions and other oral surgery codes. Orthodontics are braces. Adjunct services are miscellaneous services. We also have some conditions and then other or just miscellaneous codes. Multi-codes are specific for practices. Dental diagnostics are some new things that they're doing. Down below we have progress notes. Progress notes will show everything that you chart on the patient's chart will show up down here. So let's go ahead and chart some things. First, we have to pull up a patient. we are going to choose File, Select Patient, or we can use our little blue guy, and we are going to just choose a patient that's in the database. I'm going to choose Carrie Taylor. Click OK. And now you see Carrie Taylor's name is here. Also, it says Dentrix Patient Chart, Taylor Carrie here. So you know that you're in the right patient's chart. We see some more icons now that we have a chart or a patient pulled up. We can see our prescriptions icon is lit up. Almost every icon now is lit up because they are patient specific. We will not get into all of these, but we also have a refresh button on this page. And these are the status buttons that we'll go over here shortly. So we are going to just go over how we chart a patient. My Carrie Taylor came in today as a new patient, and when new patients come in, we have to chart everything that's already there, which is called existing. We use a status button of existing. And then if Carrie needs to have some work done, we will use the status button of TX. That's treatment that needs to be done. It's also color coded. I think you guys should have gone over colors, or if not, you should be close to it. But existing will show up in black. TX, treatment needed, will show up in red, and treatment that is just completed will show up in blue. And that's by choosing this little check button, status bar, or status button, sorry. So just to again, emphasize what the chart is for, and pretty much you guys probably already know this, but it's to document the patient's status, current oral health status. So the status of their mouth as they came in to see us today. All the dental needs are documented, and all previous treatment is documented, and treatment that they will receive today is documented. So those are some areas that are addressed. So let's go ahead and post some existing treatment. So let's say that Carrie does not have her wisdom teeth. We are going to select teeth 1, 32, 16, and 17. Not sure how Carrie is, but let's just say she's 20. And we will select our extraction procedure button, and that's the button that has the double lines. Or you can go to our oral surgery category and choose extract here. So we will click on our procedure code. That's this area. And then we will choose that this is existing. Well, when we use a procedure code, we have one more step. We choose this post button. We choose that, and now it allows us to choose a status button. So we said these are already existing, that meaning that she came in with her wisdom teeth already removed. Click the existing button, and now those teeth have disappeared. Notice at the bottom under progress notes, we have teeth 1, 16, 17, 32 are extracted, and they show up in black because they're existing. So now we are going to just take a look and see some treatment that needs to be done. So we're going to say that teeth 8 and 9 need to have a crown. So we selected our teeth first. We have a crown button. It's a procedure button. I call them our quick buttons. We select that button. Then we click on treatment. Now it shows in red that these two teeth need to have crowns. Below, under our progress notes, it shows 8 and 9 need to have crowns. If you click off of that area, click on something else, we will see that those are there, and typically it shows up down at the bottom. Some people can choose to have their progress notes show up in different colors as well, but your status over here is what tells you you know what the status is. The others were E as an existing, TP is treatment planned, meaning that treatment needs to be done. Okay, so we're going to say that she had some work done today. We are going to just no work on the teeth. She just came in and had an exam done, a cleaning, and some x-rays. So since they really are not teeth specific, they're overall, those codes do not require us to select a tooth first. We have some of those quick codes over here. Comprehensive oral evaluation, we'll click on that, and then it goes to this area, this little box, and now you can choose your completed button. That was completed today. We won't see anything on the chart again, but we see it at the bottom with the status of C. Also, she had 4 bite wings. Click on the procedure button, says 4 bite wings, and we choose completed. Again, at the bottom, we have the 4 bite wings that were completed. Next is a cleaning. We'll click on adult prophy and on our completed button. Again, we have those that are completed here in our status button. So that's how you post or chart treatment. We have charted existing, where these teeth are removed. We have charted treatment that needs to be done and treatment that was completed. So I'm going to go ahead and end this video. That's all I'm going to go over. What I will do is have another video that will go over the treatment planner. I just don't want your videos to go too long, to be too lengthy. So this concludes the chart. Again, just to pull up, to re-emphasize some things, we have the chart view. Now, if we click on the arch view, you can see the arch of the teeth and everything that has been charted. Let's look at that model view, same thing. Move it around. You see those back teeth, those wisdom teeth are missing, upper and lower. Okay, just click back on your charting view. And remember our modules, we're in the Dentrix Patient Chart. We have our procedure buttons, our procedure codes. We have our status buttons. I have listed the steps that are required to chart treatment. We have one extra step when we're using the procedure codes, because we have this little tooth here, the post button. When we just use a tooth and a procedure button, we don't have to use our post button. We simply go straight to our status button. All right, let me know if you guys have any questions. I hope you have a wonderful week.